So one final point about the pulmonary circulation before we end this lecture, basically just that we have to comment on pulmonary vascular resistance. And as I already said, pulmonary vascular resistance is normally quite low in the pulmonary circulation. The way that we can calculate pulmonary vascular resistance is extremely similar to the way we learned how to calculate the systemic vascular resistance. It's just going to be basically resistance equals pressure divided by flow. It's really similar to Ohm's law, where we said that the resistance is equal to the voltage divided by the current. In this case, we have the resistance is equal to the pressure divided by the flow. Putting this in more correct physiologic terms, it's going to be resistance of the pulmonary vasculature is equal to the pressure in the pulmonary artery minus the pressure in the left atrium, so that's the pressure difference across the lungs, divided by the cardiac output, which is your flow. So the final equation is PVR equals pulmonary artery pressure minus left atrial pressure divided by the cardiac output. So that's how you calculate pulmonary vascular resistance, and the pulmonary vascular resistance is going to be also dependent on a couple properties that are intrinsic to those vessels of the lung. One of them is going to be the viscosity of the blood. So again, just like we talked about with systemic vascular resistance, if the blood is very viscous or very thick, that's going to cause an increase in the resistance to blood flow through the vessels. Likewise, the radius of the pulmonary vessels is going to be a very important determinant of the pulmonary vascular resistance. So when we talked about the systemic vessels in our cardiovascular lectures, we mentioned the fact that the resistance is actually inversely proportional to the radius to the fourth power. And the same holds true here in the lung. And what that means is that even a tiny change in the radius of a pulmonary vessel is going to result in a huge change in the resistance to flow. One other sometimes tested point on step 1 about the pulmonary vascular resistance is that during the normal respiratory cycle, there is one point during the cycle where the pulmonary vascular resistance is reliably the lowest. And that point is going to be when you reach your functional residual capacity. Again, FRC is equal to your expiratory reserve volume plus your residual volume. So this is functional residual capacity, which is basically the value of the amount of volume in your lungs when you're finished a regular tidal volume exhalation. Peripheral vascular resistance is lowest at this value, at the FRC, for two reasons. The first is that inhalation, when you're actually inhaling, so not at the FRC, but when you're inhaling, that's going to cause an increase in the pulmonary vascular resistance because it's expanding alveoli, putting pressure on the blood vessels around them. So that should make sense. So when you're trying to take a deep breath in, you're going to be increasing pulmonary vascular resistance. Right? You've got alveoli pushing on the blood vessels. Likewise, when you're actively exhaling, so pushing breath out, you're actually causing an increase in the pulmonary vascular resistance because of collapsing pressure that you're putting on the lung parenchyma. So you can imagine if you're breathing out forcefully, you're putting some pressure on your airways, and you're putting some pressure on the blood vessels that surround the airways. So both forced inhalation and forced exhalation cause an increase in the pulmonary vascular resistance. So the only time that you're not inhaling or exhaling is going to be at this point where the airway pressure is 0, and that's at your functional residual capacity. And it's at that point where the pulmonary vascular resistance is the lowest. So that concludes our lecture on pulmonary mechanics and pulmonary circulation.